I'm here to pick up my metformin.
Hi, my name is Fong. I'm the pharmacist. Could you please give me your last name and date of birth, please?
My name is Tracy, my last name is Vu, and my birthday is 1/7/1988.
Okay, Tracy, I do see you in our system. How has your metformin been working for you? I've seen that you've been on it for a month now.
Yeah, I don't think it's working though. I have these major headaches, and I'm thirsty all the time. And I just don't think it's been working. My blood glucose has been very high.
Oh, so at least you're monitoring your blood glucose?
Yeah, totally. My doctor told me to every day.
Okay, so, well, it sounds to me like your diabetes isn't well controlled even with the metformin. What we can do for you is to add insulin therapy to it. Is that something you'd be interested in?
Well, diabetes runs in my family, and I remember my grandma started on it. She started on insulin right before she died, so I feel that it actually made her worse.
Oh, okay, so that's a myth. Actually, insulin therapy will really help get your blood sugar under control. Unfortunately, maybe for your grandma, starting insulin therapy was a little bit too late for her because there are a lot of complications that can happen when your diabetes isn't well controlled. That's why I think we should get insulin therapy started for you right away before those complications happen.
Okay.
Okay, so what I'm going to do for you now is to contact your doctor and get that prescription for the insulin for you. Do you mind waiting a couple of minutes?
I guess I can.
Okay, so you can have a seat in the waiting area while I call your doctor, and I'll call you when I have it ready for you.
Okay.
All right, thank you.
Hello, Dr. Wanwan's office.
Hi, Dr. Wanwan. This is Fong from MCPHSU Pharmacy calling. How are you today?
I'm good. How are you?
Good, thank you. I'm calling about patient Tracy Vu. I'm calling about her diabetes management. She was started on metformin last month to control her diabetes, but she is still experiencing symptoms of hyperglycemia. Do you have her A1C level on file by any chance?
Her A1C. Do you know when it was taken?
Should be about a month ago.
Okay. You really need it?
Yes, I do, to make the best recommendation for her.
Okay. What'd you say your name was? Tracy what?
Tracy Vu.
Vu. Okay. Okay, it looks like her last A1C was 11%.
Okay, at that level, according to the current guidelines, she should be on dual therapy with both metformin and insulin. I recommend starting her on Lantus, 10 units injected subcutaneously, once daily as well for now. We should follow up with her in 3 months to get a new A1C level and see how well she's being controlled, as well as ask the patient to continue to monitor her blood glucose at the same time.
Okay. Well, go ahead and start the Lantus, and can you just remind her to make a follow-up appointment?
Sure. We'll follow up with her at the pharmacy, and I'll make sure to remind her to make an appointment with you in 3 months.
Okay. Is that it?
Yep, that's it. Thank
Okay.
you.
Bye.
Bye-bye. Ms. Vu, please come back to the pharmacy. Hi, so I've contacted your doctor, and she has prescribed you with 10 units of Lantus once daily. Since this is your first time using insulin for your diabetes, it's worthwhile to go over the proper techniques how to administer your insulin. Do you have a couple of minutes for me to go over with you?
Well, I guess I do.
Okay, perfect. So follow me to our patient counseling room. Please have a seat. So the first step, before you even start with any insulin injection, is to get everything ready for you. Your doctor has prescribed you 10 units of Lantus, like I have said, once daily. So you'd be doing this once a day. Just get everything ready, like your 2 alcohol wipes, your vial of insulin and your syringe and needle. Okay? What I like to do first is actually clean the area of injection. The area of injection could be anything from your abdomen to your arm to your thighs, and you can rotate these sites on a regular basis. So just wipe your site of injection like this and wait for it to air dry. While you let it air dry, you can continue by getting your syringe and needle ready. Open the syringe like this and clean your vial with the second wipe. Take the lid off like that. Remember to clean the rubber part underneath your lid at least 5 more times with an alcohol wipe. With the 10 units of Lantus, what you need to do is uncap your needle. Okay. Draw in 10 units of air. So you pull down all the way down to the 10 mark right there. Do you see it?
Yeah.
Okay, right. And then you would just go in and puncture the rubber into your vial, flip it up and upside down, slowly administer the air into the vial, and withdraw the liquid or the content now into the syringe, up to the 10 mark, right there. Okay? Make sure there aren't any bubbles. If you see any air bubbles, just kind of flick the syringe carefully and slowly and get rid of it. And do so until you have 10 units. Okay, perfect. All right. What you need to do now is go to your site of injection and pinch the skin very lightly so, and inject the needle at a 90-degree angle like this. Slowly inject the content underneath your skin, subcutaneously. Slowly too. And wait 10 seconds before you pull out the syringe, okay? So just count to 10. And then pull it out slowly. Then you need to properly dispose the needle in a sharps container. Remember that you need to do this or administer your insulin on a consistent basis at about the same time every day. All right? So there's a lot of things I just went over. I just want to make sure that you kind of get the main ideas of what we went over. Can you kind of repeat what I said?
Well, first I have a question. Will I get fat from this?
Oh, yes, that's a possible side effect along with dizziness, or you might experience a little bit of a stomach upset sometimes. But if you get worse, then you can always contact your doctor. And for your insulin, you could always store it in the refrigerator until if you haven't opened it, you can store it until it expires or the expiration date is printed on the bottle. Once you've opened it, then it's only good for 28 days, and you need to use the content within 28 days. So, is there any more questions before you tell me the main points?
No.
So, can you please go over the main steps? Just making sure since it's your first time.
Well, first, I would gather everything, and I would take an alcohol wipe and clean the site of injection, and then I would take out my needle, get that ready, and then I would also take another alcohol wipe, and then I would wipe it like that, and I would squeeze this.
And by this, you mean your site of injection?
Oh, totally, yeah.
Okay, that's good.
And then I would insert my needle, and, well, first, before that, I forgot. Oopsies.
That's right. That's right.
I would draw out 10 units of air, then take the insulin and then draw out 10 units of that, and I would take this and inject it slowly, hold it there for 10 seconds, then draw it out slowly.
Okay, then what happens next?
I would toss the needle.
Oh, and by tossing you put it in
A safe disposal.
for sharps.
Yes,
right?
yes.
Okay, perfect. Well, that sounds like you've gotten the main points down, the main steps down. Do you have any other questions for me?
No.
happen to have any questions later on, you can always contact me here at the pharmacy. But first and foremost, you need to remember to make an appointment with your doctor, Dr. Wong, in 3 months, so then we can check your blood glucose level, your blood sugar level, so that we know the dual therapy is working well for you, okay? Before you leave, let me hand you a printout of all the steps that we went over today on how to properly administer your insulin. So in case you forget, you can refer to this, okay?
Okay.
All right, well, thank you for